Before we start with our lesson, let us put ourselves in the presence of the Lord in the name of the Father, and of the Son, and of the Holy Spirit. Amen. Our Father in heaven, we, the AUF community, consecrate ourselves to the cause of truth, that in all our aspirations we may contribute to the greater good. Born from the heart of the Church, grant us the commitment to serve, promote dignity of every person, and build an authentic human society. May we constantly strive to become mabuti, magaling, at may malasakit sa kapwa, that we may attain total development of humanity for your greater glory. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Okay, good afternoon or good morning to everyone. So this is in anticipation of suspension of classes this coming Friday. Okay, so I have decided to do a video discussion instead so you can be able to catch up. And also, we'll be talking about the history of medical technology on this for this discussion. Okay, so next week, expect a short quiz, a 15-item quiz on the start of our time on Friday. And then afterwards, we'll be having our topic 2 discussion, which is about the medical technology profession. Okay, so as one of the disadvantage of having online classes or video discussion, recorded video discussions such as this are unnecessary noises. So please bear with me if sometimes you'll be hearing unnecessary noises in the background. Okay, so let's start with our discussion. Their topic is about the history of medical technology. So first, let us define first what is medical laboratory science. Okay, medical laboratory science class is also synonymous to medical technology. Okay, so this is another term for medical technology. And if you can still remember on our orientation on the first day of our classes, I have asked you the reason on why you chose the course medical technology. Okay, so some of you said that the reason why you took up medical technology as your course because you will be studying medicine further. Okay, so this medical technology course is a good preparatory course for medicine. And others also chose medical technology because they want to be the first in the family of engineers, in the family of accountants. So sila yung mauna daw na maging medical technologies family, and then others were influenced by their relatives or even their parents. Okay, so let's define medical laboratory science. So most probably class, you know the reason or you know what to expect with the course of medical technology. Okay, so if we are going to define this, it is a health profession, a allied health profession which performs laboratory analysis that can aid in the diagnosis and treatment of disease as well as in the maintenance of health. So ibig sabihin class, you will be working inside the laboratory and you will be the one to perform the analysis of different biological specimens. So when we say biological specimen, we deal about urine, sputum, stool samples, and other body fluids. So we analyze this different specimen in order for us to help the doctor or the physician to help in the diagnosis of his or her patient. Once we have released a laboratory result, this can aid in the proper diagnosis as well as the treatment of diseases of his or her patient. Okay? And also in the maintenance of health. So ano ibig sabihin nito? So if you can see, if you have noticed, sometimes yung mga parents nyo, even if without any disease, no, wala silang nararamdaman sa katawan, monthly or even annually, they go to the laboratory for a laboratory workup. Okay, so in order for them to maintain their health and to know in advance if they need some medications, like for example, tumataas ba yung cholesterol nila, tumataas ba yung uric acid. Okay, so at least they know in advance what should be done in order for them to maintain good health. Okay, so class, even if sinabi kong a medical technologist or a medical laboratory scientist performs laboratory analysis, hindi lang tayo purely analysis of biological specimen. So before analyzing the specimen, we have to collect them first, di ba? So pasok pa rin tayo doon. So aside from analysis of laboratory specimen, we also collect the sample. For example, we collect blood. Okay, tayo yung gagawa nun. Okay? And also aside from sample collection, laboratory analysis, we also conduct quality control. So what is quality control? This is done to ensure that the instruments that we are using inside the laboratory are functioning correctly. Dapat calibrated sila. Okay? And also, pag quality control, we also have to make sure that the reagents that we are using are not expired. Okay? So, class, kasi kapag gumamit tayo ng expired na reagent, so ano expect natin dun sa result? So, definitely, it will not be accurate and precise. Okay? So, pag tinanong kayo, ano pa yung ginagawa ng medical laboratory scientist? Okay? You analyze biological samples. Okay? So, ano yung purpose of this? Okay? So we analyze biological specimen because we want to help in the diagnosis and treatment of the disease of our patients. Okay. So for the topic 1, our topic will be the history of medical technology. So have you ever wondered how doctors learn about our bodies and also fix things when they're not working quite right? So the history of medical technology comes in dito, okay? So it's like a story of how smart people came up with different laboratory tools or medical equipments to help our physicians now to figure out what's wrong and make us feel better. Okay? So, from a long time ago, kasi class during the ancient times, wala pa tayong stethoscope. Okay? So, eventually, following the history of medicine and medical technology, we will eventually know kung saan nanggaling yung different equipments that we are using currently. Okay? So, because of these inventions, no, and innovations, they have changed a lot, especially in our healthcare system. Okay, so for the learning objective of this topic, at the end of this unit, you are expected to understand the initial beginning of medical technology profession and also the development of medtech education and its practice in various professional fields. And also, no, aside from discussing the history of medtech here in the Philippines, we also want to discuss about the history of the profession in a global context. Okay? And then, of course, we should be able to identify who are these famous scientists, who are these personalities that played a significant role in the progress of the profession. Ito yung mga inventors natin. Okay? So now let's proceed with the history of medical technology in a global context. Okay, so before class, the early medical diagnosis treated disease as a mystery. Okay, so mystery daw siya. Okay, so these diseases were often seen as mysterious and poorly understood. And because of this, because people do not have the scientific understanding or even the technology. Ibig sabihin, pag technology, the people doesn't have the equipment to comprehensively study the causes behind the diseases. So as a result, many illnesses were shrouded in mystery and superstition. And before class, the early medical diagnosis, which spans thousands of years ago na, no, is yung medical diagnosis natin was very different from what it is today. Okay? So ano yung difference? Okay? So before, it lacked the sophisticated tools and knowledge that modern medicine has today. So the physicians relied primarily based on their observations, patient histories, and limited remedies. Since kulang nga tayo sa technology, kaya nga yung remedy to treat that particular disease is somehow limited. Okay? And then again, the disease during the ancient times to is believed to be caused by a negative interaction between the environment and the body. So, ibig sabihin, during the ancient times daw, the early medical practitioners believed that diseases were caused by the body's imbalance. Kapag sinabing body's imbalance, it's either merong sobra, merong kulang dun sa body. Okay? And also, sometimes it is often attributed to external factors such as the environmental conditions. Okay? So this concept, class, is based on the ancient Greek history of the four humors. These four humors, pag-aaralan natin sila later, daanan natin sila, no? These four humors, or what we also know as the four body fluids, were yun nga no, yung concept na sabi ko kanina that there is imbalance. So merong imbalance between these four humors. So ano yung four humors or the four body fluids? We have the blood, we have phlegm, we have black bile, and the yellow bile. Okay? So these four humors daw, okay, kapag meron daw imbalance, these were thought to be responsible for various diseases. Ibig sabihin, pag kunwari, yung isang tao daw has an imbalance of blood, okay? So, pwedeng yun ang responsible for the occurrence of the disease of the person. Okay. So, during the 300 BC to 100 AD, okay, yung mga sikat during those times are Hippocrates and Galen. Okay? This Hippocrates is the father of medicine and author of the Hippocratic Oath. So, kapag nakikita nyo yung nasa mga medicine, mga medical students, they know the Hippocratic Oath kasi to commemorate what Hippocrates has done in the field of medicine. Kaya siya yung tinawag na medicine, na father of medicine. And also, Galen, a Greek physician and philosopher during those times. Okay, so both of them, Hippocrates and Galen, instigated a qualitative assessment of disorders through the measurement of the four body fluids or the four humors. Ito yung sinabi ko kanina. Okay, so they assess the disorders by measuring the four body fluids or the four humors, namely blood, phlegm, yellow bile, and the black bile. Okay. So si Hippocrates alone naman, no? Si Hippocrates, since he is the father of medicine, so his principles and ideas become the foundation for the ethical practice of medicine. And also, class, sa kanya galing yung scientific observation. Okay, scientific observation. So, ibig sabihin ng scientific observation, it is closely observing the patients and their symptoms. So, purely observation lang tayo of the patient as well as the patient's symptoms. Okay, so these four humors daw or the four body fluids are influence a person's health and temperament. Okay, so pag-usapan natin siya as we go on with our discussion. Okay, so these are, again, the four humors or the four body fluids. Okay, we have blood, phlegm, yellow bile, and the black bile. So this is according to the theory of the four humors, which is an ancient medical concept. Okay, so the body daw is composed of four primary fluids, and the person's health and personality is influenced by the balance or imbalance of these four humors. Okay, so each humor daw or each body fluid is associated with specific qualities and physical well-being. Okay. If you have noticed, no, inisa-isa ko siya. And if you can see the blood, okay, the blood is considered as the most vital. Okay, so kung natatandaan nyo, sabi ko kanina, yung body fluids are also correlated with the temperaments of the person. Yung mga temperaments is sanguine, choleric, melancholic, and phlegmatic, di ba? Okay, so for example, excess blood. Okay, meron kang excess blood. Kasi 'di ba, ang mini-measure nila dito is if there is an imbalance. So kapag sinabing imbalance, there is an excess or there is a shortage of that particular body fluid. Okay. For example, si blood daw is considered as the most vital and is produced by the liver. Okay. So, if there is an imbalance daw, if there is an imbalance of blood, it can result to sanguine temperament. So, ano ibig sabihin nun? Kapag daw may imbalance, the person may look like the person is cheerful. Masayahin siya, optimistic siya, and sociable siya. Kaya nga sanguinic siya. Okay? And also, kapag may imbalance ng blood, the person may also experience fever or has an inflammatory disease. Okay. Next one, yellow bile naman. Okay? Yellow bile is related to choleric temperament. Again, if meron siyang excess or imbalance of the yellow bile, the person um, may be choleric. So kapag choleric, ano yung temperament niya? Ano yung personality niya? Ambitious, assertive, and madali siyang magalit. Kaya siya choleric. Okay? And also, if there is an excess of yellow bile, meron siyang, the patient might have jaundice. So jaundice, anong ibig sabihin ni jaundice? Ito yung yellowish discoloration of the skin and of the eyes. Okay, so nagye-yellow siya. Usually kapag jaundice ngayon, 'di ba? Sinasabi nila merong liver disease yung tao. Okay? And also excess of the yellow bile is also suggestive of digestive disorders. Okay? Same as black bile naman. The black bile is produced in the spleen. Okay? And if a person has an imbalance of the black bile, the person has a temperament or personality of being melancholic. Pag melancholic, the person may be sensitive and also prone to sadness. Okay? And again, if may imbalance siya for the black bile, it can manifest as the person having depression and digestive issues. Okay? Same with phlegm naman, no? Si phlegm is produced by the brain and other organs. And imbalance daw may result in a phlegmatic temperament or personality. Kapag meron kang phlegmatic personality, you are calm, kalmado ka, and unemotional. Ibig sabihin, pag unemotional, walang emosyon, ibig sabihin din natin, pag walang emosyon, NR, no reaction. Okay. And sabi nga nila, if there is an imbalance naman daw of phlegm, as in phlegma, okay, there is congestion in the body and the person might also be suffering from respiratory ailments. Okay. Again, class, these four humors are correlated with the temperament and personality of a person. Okay, so dapat balanse daw, hindi sobra, hindi rin siya kukulang. Okay, so what if class, sa imbalance na yon, meron sumobra. Okay, sumobra kunwari si blood, sumobra si yellow bile, sumobra si black bile or phlegm. So physicians sought to restore the balance among the various intervention. So, meron tayong intervention such as dietary changes. I-change mo yung diet mo to be able to balance these body fluids. And also, meron din tayong purging. Yung purging class refers to the act of removing or eliminating something from the body. Okay, purging. P-U-R-G-I-N-G. So, it refers to the act of removing or eliminating something from the body. Okay, so paano natin eliminate? For example, meron nga siyang excess body fluid sa body. So ang gagawin natin, we will resort to purging kasi we will be removing or eliminating the excess body fluid from the body. Okay, so paano? There are ways to purge. Okay? Meron by induced vomiting. Parang if-force natin the person to vomit through the use of medicines. Ang tawag sa medicines which can induce vomiting are emetics. E-M-E-T-I-C-S. Emetics. Emetics can induce vomiting. How about naman for the bowel movement, no? Yung poops natin. So, paano natin i-remove yung excess dito? Paano tayo magre-remove ng poops? Okay? By the use naman of laxatives. Okay? To remove or stimulate bowel movements, we can use laxatives. Okay? And aside from the use of emetics, the use of laxatives, in order to purge, we can also do bloodletting. Bloodletting, yung parang bloodletting sa blood donation. Okay? But during the ancient times, class, hindi tayo gumagamit ng blood bag. Hindi tayo gumagamit ng plunger or needle. Okay? For the bloodletting. The bloodletting, ilalabas natin yung blood. Okay? But during the ancient times, ang ginagamit para ilabas yung excess blood is by the use of leeches or linta. Papasipsip yung dugo para lumabas. Okay? And also, pwede rin natin to restore the balance, no? If there is an excess of this body fluids, sweating, pwede rin siya. Okay? Sweating. Paano natin nilalabas yung sweat natin? Okay? By being in the sauna or steam bath. This is done to help eliminate toxins. Okay? Again, purging refers to the act of removing or eliminating something from the body. So we have different ways to purge or eliminate something from our body by the use of emetics, which can induce vomiting, by the use of laxatives, which can stimulate bowel movements and remove the waste product from the intestines, through bloodletting, by the use of leeches, and by sweating. Sweating by going to the saunas or having steam bath, okay, to help eliminate the toxins in our body. Okay, next one are the Hindu physicians. So these physicians began the practice of examining the patient specimen. Again, class, di ba, naumpisahan ni Hippocrates by observing the patient lang. Okay? So, the Hindu physicians then, by observing then, okay? But instead of observing the person, they observe the patient's specimen. Okay? They examine the patient's specimen. So, sila yung nauna. Okay? So, they were the one who began the practice of examining patient specimens. So, the oldest known test on body fluids was done on urine. Okay? Yung unang test daw na ginawa sa isang body fluid is done on urine o ihe. Okay? Kaya nga, we consider urinalysis as the oldest laboratory procedure. Okay? The oldest laboratory procedure is considered as urinalysis. Okay? Because they believe that urinalysis helps in the disease diagnosis during the Middle Ages. Okay, so ang napansin nila, class, during the Middle Age, no, there are certain urine samples that are easily attracted to ants. Okay? And yung iba din also observed that the urine had a sweet taste. Kasi, class, during these Middle Ages, tinitaste nila yung urine. Okay? So, napansin nila that there are certain urine samples that are easily attracted by ants and had a sweet taste. Matamis daw yung urine. Okay? And they have discovered that this particular urine samples were from diabetes mellitus patients. Di ba, class, sinasabi kahit ngayon, di ba, kapag diabetic daw si patient, okay, pwede mong masabi na diabetic yung isang patient if yung urine niya is usually attracted to ants, yung nilalanggam. Okay? So, during the Middle Ages, they began the tasting of urine and the examination of the urine. Okay? So, nakita nila na there are some urine samples that are easily attracted by ants and had a sweet taste. So, nagkataon that these samples were from diabetes mellitus patients. Okay? Ito. So, ito siya, yung tasting of urine. Kaya nga nila nasabi na the taste of urine sample from a DM or diabetes mellitus patients is sweet. Okay? So, nilalasahan nila yung urine. Okay? And then, class, meron din, no? Sa urine daw, when there is an appearance of bubbles, blood, and pus in the urine. Kung bumubulab daw ba si urine, pag may presence din ba ng blood, and kung may presence din ng pus or nana. Okay. So, the appearance of these bubbles, blood, or pus in the urine indicates kidney disease and chronic illnesses. So, during the Middle Ages class, no, if a urine has bubbles, blood, and pus, it indicates kidney disease and chronic illness. Okay? So, kaya nga, no, ino-observe nila yung patient sample. And yung patient sample is the urine. So, pag na-observehan nila that there is the presence of bubbles, that there is the presence of blood, and there is the presence of pus, it indicates that the person has a kidney disease and chronic illness. So, diabetes, since it is easily attracted to ants and has a sweet taste, sabi nila, is called or considered during those times as the diarrhea of urine. Okay. So, class, paano nila ino-obserbahan? Okay. So, ang gagawin nila is water casting or uroscopy. Okay. This is practiced during the Middle Ages. Ibig sabihin, kapag water casting, we will be asking the patient to put their urine in a decorative flask. Okay. So, dito sa decorative flask, the patient will be putting their urine for examination. Okay. And then, class, during those times, no, physicians who failed to examine the urine were subjected to public beatings. Okay. Kapag hindi nila in-examine yung urine, yung mga physicians, hinahampas sila. Okay? Public beating. Okay. So, balikan natin si diabetes as the diarrhea of urine. Bakit nila sinabing diarrhea of urine yung diabetes na condition? Okay? Because class, kahit ngayon, no, the diabetes, if a person has diabetes, meron siyang symptoms such as excessive urination or polyuria. Okay? Meron siyang symptom of excessive urination or what we call as polyuria. Yung lagi siyang umiihi. Okay? And then another is the sweetness of the urine. Okay? The sweetness of the urine because of the very high glucose levels. Okay? Why do we call diabetes as the diarrhea of urine? Because some symptoms of diabetes are excessive urination, laging ihi ng ihi or polyuria, and also the urine of the diabetes mellitus patient is sweet because of the very high glucose levels. So let's proceed with Rufus of Ephesus. Okay? Rufus of Ephesus made the first description of hematuria. So what is hematuria? Okay? So putol-putulin natin, no? So which is ito rin yung topic natin for topic 3, yung medical terminologies. So what is hematuria? So heme is other word for blood. Okay? Hema meaning blood, and uria is urine. Okay, so pagsamahin natin, hematuria is the presence of blood in the urine. Okay, so Rufus of Ephesus made the first description of hematuria or blood in the urine. So he is an ancient Greek physician. Okay, so he is a Greek physician wherein he made the first description of hematuria or the presence of blood in the urine. So, just to add a few facts about hematuria, okay, so iti-take up nyo pa rin ito sa third year sa analysis, sa AUBF analysis of body fluids and also sa hematology. Okay, so just to give you an overview what hematuria is, again, this is the presence of blood in the urine. So we have two kinds of hematuria. Okay, we have the macrohematuria or gross hematuria. So other name for macrohematuria is gross hematuria, okay, wherein there is the visible blood. So makikita nyo agad na there is a visible blood sa urine. Wow! Okay? There is a visible blood in the urine, meaning nakikita nyo with your naked eye. So most probably, the color of the urine sample will be red. Okay? Pwede din siyang tea-colored, parang tsaa. Or minsan pinkish or brownish red. So pagka-submit pa lang sa inyo ng urine sample, if nakita nyo siya na colored red, colored parang tsaa or tea, colored pink or brownish red, so it is conclusive that there is hematuria. So ano yung term doon? Kasi visible yung blood na nakita natin sa urine. That is macrohematuria. Okay? So another kind of hematuria is microhematuria. Microhematuria. Ibig sabihin nito, kabaliktaran ni macro. Okay? For microhematuria, the blood is not visible. So, isasubmit sa inyo yung urine, ganun pa rin ang hitsura ng urine. Yellowish, or clear, or transparent, or light yellow. Ganyan. Diba? But, the presence of blood can be seen, or can only be seen, under the microscope. Okay. Next one is Frederick Dekkers. So, ano naman ang ginawa ni Frederick Dekkers? He observed that proteins in the urine precipitated when boiled with acetic acid. Okay. So, class, no, the presence of protein in the urine, related ito sa renal disease. Okay? Kahit until now, class, when a person has the presence of protein in the urine, it may be conclusive that the person has a renal disease. Okay? So, up to this day, the presence of protein in the urine is the most important and the most sensitive sign of renal disease. Okay? So, there is the presence of proteins daw when heated. Okay? So, kapag hinit yung urine, okay, pag may presence of protein daw, makikita nyo dun sa ilalim that there is the presence of a precipitate. The urine has the presence of protein. When boiled with acetic acid, it will produce a precipitate dun sa ilalim niya. Okay? So, let's proceed to Frederick, or this one. Si Hermann von Felling. Okay? So, si Hermann von Felling, ano naman ang contribution niya? So, based sa history, he performed daw the first quantitative test for urine sugar. Again, related pa rin siya sa urine. Okay? So, this scientist is a German chemist and the developer of the Felling solution. Okay, so this Felling solution is used to estimate the sugar. Okay, so kaya ang tawag for the estimation or for the quantitative test for urine sugar is Felling's test. Dito yon nanggaling kay Hermann von Felling. Okay, the Felling's test is a chemical test to detect the reducing sugars, the presence of reducing sugars and aldehydes in a solution. Okay? So, the Felling solution will be added to the urine. Pag inad yung Felling solution dun sa urine, kapag positive yung urine with reducing sugars, it will produce a red color. Okay? So, again, if a Felling solution is added to a urine sample, and if that urine sample has the presence of reducing sugar or positive for reducing sugar, the urine will turn into a red color. Okay, so ano ba yung composition of the Felling solution? Okay, so the composition of the Felling solution is copper sulfate and sodium hydroxide. Next one is the Ebers Papyrus. So this is a book, no? So parang considered ito as the Bible, okay? As the Bible for about the treatment of diseases, because this is considered as the book of the treatment of diseases. So this is the oldest preserved Egyptian compilation of medical texts. So it is a 110-page long scroll which measures 20 meters long. Okay? So it is a 110-page long scroll which measures 20 meters long. So mahaba-haba siya kasi nga 110 page siya. Okay? So it contains chapters about pregnancy, eye and skin problems, surgery, burns, intestinal diseases, and parasites. So parang if gusto nating malaman about pregnancy or common eye and skin problems, ito yung kukonsultahin natin, the Ebers Papyrus. It is a book for the treatment of diseases. Parang ito yung manual natin. Okay? Next one is Vivian Herrick. Okay? Vivian Herrick traced the beginning of medical technology when intestinal parasites were first identified. Okay. So ano yung mga intestinal parasites that she identified? Okay. So there are two intestinal parasites that Vivian Herrick were first identified. First one is the Taenia. Yung spelling niya is Taenia, Taenia, or what we also know as the tapeworm. Okay. Taenia or tapeworm. And then another intestinal parasite is the Ascaris. Okay? Ascaris is also known as a roundworm. Again, intestinal parasites, no? The two intestinal parasites that were first identified by Vivian Herrick were Taenia or Taenia, also known as a tapeworm, and Ascaris, which is a roundworm. Okay. And sabi ko nga kanina, no, the description of intestinal parasites is also contained in the Ebers Papyrus. Okay. So, puntahan natin, no, a konting overview lang with these intestinal parasites. But when you will be in the second semester of second year, or of your sophomore year, you will be taking up parasites and you will be encountering these different parasites, no? So as an overview lang, Ascaris or the roundworm can be obtained from having a poor hygiene. For example, no, ako is infected with the Ascaris. This is a worm, no, roundworm. For example, I am infected with an Ascaris. Okay, so nagpupo ako. And then, after I defecated, hindi ako nag-wash properly with my hands. Okay? And then, afterwards, after going to the bathroom without properly washing my hands, nag-prepare ako ng food. Okay? And served it to you. So, po pwedeng mailipat yung eggs nung Ascaris ko sa inyo. Okay? So, magkakahawaan na tayo. So, this is because of poor hygiene. How about the Taenia or the tapeworm? Okay? So, Taenia or the tapeworm, pwede siyang can be seen in beef and pork. Okay? So, paano natin na-acquire si Taenia? Okay? Because of improper cooking. Okay? Kasi Taenia can be seen in cows and pork sa mga baboy. Okay? So, improper cooking of beef and pork can also transmit the infections. Kunwari sa samgyup nyo, pag nagsasamgyup kayo, di ba? Meron kayong beef, meron kayong pork, and pag hindi proper yung cooking or insufficient yung cooking, po pwedeng magkaroon kayo ng tapeworm. Okay? Next one. Next one is Anne Fagelson. Okay? So Anne Fagelson, okay, believed that medical technology started at the University of Bologna. Okay, so medical technology was defined also by Anne Fagelson as the performance of laboratory determinations and analysis used in the diagnosis and treatment of diseases. Kung ano yung definition natin kanina ng medical laboratory science. Okay, and then Alessandra Giuliani naman, Alessandra Giuliani was employed by Fagelson at the University of Bologna to perform tasks in the laboratory. And also, Alessandra is the first female anatomist and prosector. So ano yung prosector? A prosector dissect corpses for examination. Dinidissect niya yung mga patay for examination. Okay? Next one is Rudolf Virchow. Rudolf Virchow is the founder of the Archives of Pathology in Berlin and also known as the father of cellular pathology. Okay, why? He is considered as the father of cellular pathology because he emphasized that most diseases could be understood in terms of the dysfunction of cells. Okay, ibig sabihin daw, okay, that the whole organism, okay, the whole organism does not get sick daw. Okay? Only certain cells or group of cells. Kumbaga yung tao, it doesn't get sick yung buong pagkatao ni tao eh. Okay? Only certain cells of that particular person. Okay. Kaya nga, she was or he was considered as the father of cellular pathology. Again, class, cellular pathology is the study of organs and tissues. Okay? So, by viewing them under the microscope, we can be able to study the organs and tissues of a person. Okay? Again, ibig sabihin, no, the disease daw is caused by the changes in the normal cells because the whole organism does not get sick daw, only certain cells or group of cells. Kapag merong changes, abnormality sa isang cell, that disease is produced. Nagkakaroon ng sakit when there is a change daw of the normal cells. Pag naging abnormal cell siya. Okay. And then another, aside from being the father of cellular pathology, okay, he also developed the Virchow's autopsy technique. Ano ibig sabihin, class, kapag autopsy? Kapag autopsy, yung examination of a dead body. Okay? Autopsy, examination of a dead body. Yung counterpart naman niya is the biopsy, wherein we examine living tissues. Okay? Again, autopsy, dead, biopsy, buhay. Okay? So, Virchow is the first to develop the Virchow's autopsy technique. Okay? So, ano tong Virchow's autopsy technique? Okay? Dito sa technique na to, the organs of the body of the dead person are removed one by one from the body to be examined. Inaalis niya isa-isa yung mga organs from a dead body and from this, ini-examine din niya isa-isa. Okay? So, because of this autopsy technique, it led to the accurate diagnosis of diseases. Next, in the 11th century, there is the poor understanding of the anatomy. Okay, because the medical practitioners were not allowed to conduct the physical examination of the body. Bawal mag-physical exam ng body of the patient. Kaya nga, there is a poor understanding of the anatomy of a person. Okay, why? Bakit bawal mag-conduct ng physical examination during the 11th century? Because the body is considered as sacred. So this is according to the religious beliefs of the people during the 11th century. Okay? Kaya nga during this time, since they are not allowed to conduct physical examination, so they rely more on body fluids such as blood and the urine. Okay? And also, during the 18th century naman, medical techniques and cadaver dissection were used. And in 19th century, John Hutchinson discovered the spirometer. Okay, yung spirometer, class, is used in lung function. In lung function to assess patients with asthma, with pulmonary diseases, okay? And also, Jules Harrison invented the sphygmomanometer. Okay, si sphygmomanometer. Ano si sphygmo? Saan ginagamit si sphygmo? Okay, dun sa measurement of the blood pressure. Okay. So what are the breakthroughs in medical technology? So ibig sabihin, class, pag sinabing breakthrough, it is a moment when researchers or scientists make a significant and groundbreaking discovery. So nakapag-discover sila or achieve a profound understanding of a previously unknown phenomenon. Yung mga hindi na-discover noon, yung mga hindi nila alam noon, when a researcher discovered something, okay, it is called a breakthrough. Okay, so what are these? First is the stethoscope. Okay, so stethoscope is very vital until now, no? So in 1816, the first diagnostic medical breakthrough was invented by René Laennec. Okay, this is the stethoscope. This is used to acquire information about the lungs and heartbeat. Okay, so laging itong dala ni doctor. Okay? Next one is the invention of a microscope. Okay, so si microscope, ito yung best friend ni medical technologies. Okay, kaya nga class, ngayon pa lang, if ever you will be having experiments using the microscope, please familiarize yourselves with it na. Okay, kasi ito yung best friend nyo. Ito yung kasakasama nyo. Okay, during your practice of medical technology. For example, no, bigyan natin ng analogy. Yung soldier, kapag wala siyang barel, he or she cannot function well. Kasi yun yung pinaka main weapon niya, di ba? For medical technologists naman, a medical technologist cannot practice fully the profession without the use of a microscope. Okay? So in 1840, the microscope was developed. Okay? So it was developed for medical purposes due to advances in lenses and lower cost. Okay? And this was discovered or devised by Anton van Leeuwenhoek. Okay? So later on, we will also tackle about Anton van Leeuwenhoek, which is considered as the father of microbiology. Because of the invention, no, there were advances in microbiology. Okay, kaya nga Anton van Leeuwenhoek is also considered as the father of microbiology kasi nga, no, we examine minute particles through the use of a microscope. So because of the advances because of the invention of the microscope, there were significant advances in the microbiology, okay, wherein Anton van Leeuwenhoek discovered the morphological characteristics of the bacteria. Okay, the morphological characteristics of the bacteria. So we have two kinds of bacteria. We have the cocci or COCCI, the cocci, which are round-shaped bacteria, and the bacilli. Okay, bacilli, BACILLI. These are rod-shaped. Kung si cocci are round or bilog, these bacilli are rod-shaped. Okay, and also aside from the discovery of the morphological characteristics of bacteria, Anton van Leeuwenhoek also discovered the shape of RBC or the red blood cell. Our red blood cells, when seen under the microscope, are shaped like a donut. Para silang donut. Meron silang concave sila, no? Makikita nyo mukha silang donut. And also, the discovery of certain protozoans such as the amoeba. Okay? And lastly, the discovery of the spermatozoa. Okay, spermatozoa or the sperm cells. Next one is the invention of a ophthalmoscope in 1850, which was invented by Hermann von Helmholtz. Okay, so this ophthalmoscope is like the size of a flashlight, which is used to view the eyeball or the eyes. Okay, so used to inspect the interior portion of the eyes. Next one is the laryngoscope. So if you're fond of watching medical drama such as Grey's Anatomy, okay, so lagi itong ginagamit kapag hindi na nakakahinga si patient, di ba? Yun yung ini-intubate siya. Okay, so it was discovered in 1855 by Manuel Garcia. So it was first devised using two mirrors to observe the throat and the larynx. So larynx, this laryngoscope is used to observe the larynx, okay, the larynx or the voice box. Okay, so because of this instrument, it allows to see the deeper function or the deeper portion of the throat, and also used to remove foreign objects for a biopsy or to get a sample tissue for a biopsy. Next, ito, familiar kayo dito, di ba? The X-ray. The X-ray was first invented in 1859 by Wilhelm Röntgen. And because of this invention, it already allowed the physicians to view the inside of the body without surgery. So without using surgery, hindi natin bubuksan, we can already view what is going on inside the body by the use of this X-ray. Okay? So X-ray is used to diagnose if the person has pneumonia and also tuberculosis during the World War II. Okay, again, the X-ray was used for diagnosis of pneumonia and tuberculosis since World War II. Okay. Medical technologies naman impacts on surgical procedure. Okay, so ano yung impact niya when it comes to surgical procedures? Okay, so let's proceed. The electrocardiograph or the ECG, which was discovered in 1903 or developed in 1903 by William Einthoven. This is used to measure electrical changes when the heart is beating. Okay, so ito ginagamit pa din natin until now, no, yung ECG machine. Next one is the Kenny method. Okay, the Kenny method in 1910 served as the pioneering work for modern physical therapy. So physical therapy naman siya, which was devised by Elizabeth Kenny. Kaya nga naging Kenny method kasi it was devised by Elizabeth Kenny. Okay, so because of this Kenny method, it prompted the invention of a new stretcher. Kasi class, kung tatanungin nyo, ano yung Kenny method? Okay, this Kenny method is devised for the treatment of polio. Okay, Kenny method is devised for the treatment of polio by using hot packs and muscle manipulation. Okay, so this is used for muscle strengthening exercises. Okay, so because of this Kenny method, nagkaroon or parang nag-induce ng invention of a new stretcher. So the new stretcher is also called as Sylvia method or mali, okay? Again, this Kenny method prompted the invention of a new stretcher, which is also called as Sylvia stretcher. Okay, the Sylvia stretcher is intended for transporting patients in shock. Okay, the Kenny method prompted the invention of a new stretcher. Okay, so because of Kenny method, nagka-invention then of a new stretcher, which is also called as Sylvia stretcher, which is used to transport patients who are in shock. Next one is the drinker respiration, which was invented in 1927 by Philip Drinker. Okay, so anong function nito? The function is to help patients with paralytic anterior poliomyelitis to recover normal respiration. Okay, so this drinker respirator class, drinker respirator, is also known or popularly known as the iron lung. Okay, iron lung. Okay, drinker respirator is popularly known as the iron lung. Okay, so this iron lung supported patients with respiratory paralysis during the polio era. If nakikita nyo may butas siya, so dyan ilalagay si patient na pahiga, okay, to aid in the respiration of the patient. Okay, so para siyang kung makikita nyo siya, parang dyan ilalagay si patient that is suffering with respiratory paralysis during the polio era. No? So this iron lung is assisted by an artificial respirator. Meron siyang respirator. Okay? Again, drinker respirator is popularly known as the iron lung. Next one is the heart-lung machine in 1939, which prompted the first visual technology invented by Hermann von Helmholtz. Okay. So this heart-lung machine is also called a cardiopulmonary bypass machine. Okay. This heart-lung machine is also called a cardiopulmonary bypass machine. Okay, so this is often used during procedures that require the heart to be stopped. Okay, pag magba-bypass tayo, 'di ba? So during bypass procedure or bypass surgery, the heart is stopped. Okay? Hindi stop yung beating niya. Okay? So this is used yung cardiopulmonary bypass machine or the heart-lung machine. Next one is the cardiac catheterization and angiography. Okay, so andyan yung details. Okay, so it is made seeing the heart, lung vessels, and valves possible through inserting a cannula. So mag-insert tayo ng cannula just like the second picture dito sa baba. Okay, nag-insert siya ng cannula using the arm vein into the heart, okay, by injection of dye in order to visualize the heart, the lung vessels, and the valves. Okay. Okay. So what is the history of medical technology naman in the United States? Let us continue the history of medical technology naman sa United States. Okay, first we have Dr. William Welch. So he taught the first laboratory course in pathology at Bellevue Hospital Medical College in 1878 and also served as the first instructor in the lab course in a medical school. Okay? And again, isa rin siya sa mga first professor of pathology naman at Johns Hopkins University. Okay? Again, taught the first laboratory course in pathology at Bellevue Hospital Medical College in 1878 and also served as the first instructor in the lab course in a medical school. Okay, kaya nga, siya yung naging first professor of pathology at Johns Hopkins University. Next one naman, another William naman, pero Dr. William Osler naman siya. Okay? Sino si Dr. William Osler? He opened the first clinical laboratory. Okay, so ito naman, nag-open ng first clinical laboratory at the Johns Hopkins Hospital in 1896. Okay, in 1896, he opened the first clinical laboratory at the Johns Hopkins Hospital. Okay, so in this first clinical laboratory, routine exams were carried out. Okay, but special attention was given to the research for malarial parasites in blood. Okay, so dito sa first clinical laboratory that Dr. Oster opened in Johns Hopkins Hospital, routine exams were done, but special attention was being given to the research for malarial parasites that can be found in blood. Okay, so Dr. William Osler had an early experience with a microscope and led to the important contributions to hematology. Okay. James Todd naman. Okay? Si James Todd wrote, okay? So he wrote the Manual of Clinical Diagnosis in 1908. Okay? So si James Campbell Todd, okay, created or wrote and published the Manual of Clinical Diagnosis in 1908. So ano tong manual na to? Okay, so this book described the techniques and procedures of the lab test which are available then. Okay, during the 1908. Kung ano yung mga techniques and procedures of the laboratory. So yan yung kinikonsulta when a medical technologist would like to view or know the techniques and procedures of the laboratories that are being done. Okay? And then, okay, so this one, tingnan natin yung difference. Si James Todd created the Manual of Clinical Diagnosis in 1908, wherein this describes the techniques and procedures of the laboratory test. Okay? And then, after that, si John Bernard Henry naman, okay, si John Bernard Henry edited or revised the book that was written by Todd and was then renamed clinical diagnosis and management by laboratory methods. Okay? So, yung unang ginawang book ni Todd, okay, inedit or ni-revise ni John Bernard Henry and ni-rename niyo yung book as Clinical Diagnosis and Management by Laboratory Methods. Okay? So, this became the fundamental source in the practice of laboratory medicine. And class, until now, this book is being used by medical technologists, lalo na sa mga magbo-board exam. Okay? Sobrang kapal nito, and also one of the books that is usually considered by medtechs. Okay? Especially those who are or who will be having their board exam. Okay? So, one of the most significant books in the practice of medical technology. So, ito yung kino-consider nating Bible. Okay? Bible of medical technologists. Next one is John Colmer. Okay? Puro John pa naman. John Colmer. Okay? He published The Demand for and Training of Laboratory Technicians. Okay? This publication entitled The Demand for and Training of Laboratory Technicians included a description of the first formal training course in medical technology. Okay? He called for the development of a method that would certify medical technologies on a national scale. Okay? So this publication, itong Demand for and Training of Laboratory Technicians, indicated the first training course and certification of medical technologists in the United States. Next one, the Pennsylvania State Legislature. Okay? The Pennsylvania State Legislature, because of the initiatives of John Colmer, John Colmer, who published The Demand for and Training of Laboratory Technicians, because of his initiatives, through the paper he published, it also required them to employ a full-time laboratory technician. So this Pennsylvania State Legislature passed a law that requires all hospitals in the United States to have a fully equipped laboratory which is fit for routine testing. And aside from having a fully equipped laboratory, it is also required to employ a full-time laboratory technician. In the University of Minnesota naman, this university offered the first to offer a degree program on medical technology. So, as you can see, nakikita na natin yung medical technology as a degree program. So, in the United States, the University of Minnesota was the first to offer a degree program on medical technology. It was in 1923. Okay, so during this time, class, 1923, World War yan. Okay, so during the World War I, okay, so there was an increased demand for a laboratory technician. Okay, so there is an increased demand for laboratory technician during the World War I. Okay, so because of this, physicians with knowledge in laboratory work began to teach their assistant. Okay, because of the increased demand for laboratory technician during the World War I, physicians with knowledge in laboratory work began to teach their assistants. So, sila yung nag-teach dun sa mga assistants nila. No? So, this is an informal education. Okay? So, wala pang formal course yet. No? So, University of Minnesota grabbed this opportunity. Kaya, in-offer niya yung first degree program on medical technology. Okay? So, during the World War II naman, okay, meron ng advances sa instrumentation. Okay? Marami ng naglabasan ng machines and equipments which are doing the manual method. Okay? So, meron ng automated equipment and quality control programs. Okay? So, again, during the World War I, there is an increased demand for laboratory technicians. So the physicians having the knowledge in laboratory work began to train their assistants. Okay, so informal education pa lang to. Wala pang formal course. Okay, and then University of Minnesota grabbed the opportunity and offered their first degree program on medical technology in 1923. So ito yung ASCP or the American Society for Clinical Pathology. So founded in 1922 to unite anatomic and clinical pathologists and also the medical laboratory professionals to advance laboratory medicine. So in the Philippines class, okay, to be able to practice, you should pass the board exam which is given by PRC or the Professional Regulation Commission. Okay? Pero, once you pass the board exam and you obtain your license, you can only practice the profession dito sa Pilipinas. Okay? Sa US naman or sa United States, yun yung ASCP. Kaya kung naririnig nyo, for example, medical technology siya dito sa Philippines, and then if he or she will be going to work in the US, kailangan niyang merong ASCP. Okay, ASCP certified siya. Okay, so this was established to better improve patient care through knowledge, collaboration, and global community. So, kung sa board exam, if you are a medical technologist here and you want to be certified by the American Society for Clinical Pathology, in order for you to work in the United States, you have to take a 100-item exam. Okay, 100 items siya, which is done in the computer. So, mag-exam ka using the computer. Okay? So, ang registration nito in order for you to have the exam is parang nasa 10,000 above. Okay? And then, kapag board exam naman, dito sa Philippines, which is given by the Philippine Professional Regulation Commission, 600 items siya. Lahat ng major subjects. Okay? Sa 100 item naman ng ASCP, lahat na nun ng subjects. Okay, so mas mahirap siya. Okay? Then how about the history of medical technology in the Philippines? Paano nagsimula yung medical technology here in the Philippines? Okay, so the first clinical laboratory in the Philippines. So the first clinical laboratory in the Philippines was established during World War II by the 6th Infantry Division of the US Army. Okay, so World War II siya. Okay, so the members of the US healthcare team. Okay, so World War II. So kailangan ng healthcare team. Okay, kasi nga to heal the wounded soldiers during the World War I. So members of the US healthcare team were brought to the country to serve the wounded soldiers and civilians to cure wounded soldiers, no? And then they have established the first clinical laboratory in the Philippines, which is located at Quiricada Street, Santa Cruz, Manila. Okay, so after the World War II, okay, nung tapos na yung World War II, the Army, okay, the 6th Infantry Division of the US Army left the Philippines. Okay, the Army left in June 1945. This is after the World War II, and was this first clinical laboratory that they have established was endorsed to National Department of Health. Okay, it was endorsed to National Department of Health. And after ma-endorse ito and umalis na si Army, na-endorse na siya kay National Department of Health, the first clinical laboratory was later on declared as non-functional, meaning non-operational na siya after umalis ng US Army in 1945 and endorsed to National Department of Health. So, nagsara. Okay. And then, this Dr. Alfredo Pio de Roda, preserved what was left of the first clinical laboratory with the help of Dr. Mariano Icasiano. Okay? Since sabi ko kanina, no, when the US Army left in 1945, in June 1945, the laboratory became non-operational until it was reopened. So, na-reopen siya in October Okay? So, in October, it was reopened by Dr. Pio de Roda with the help of Dr. Mariano Icasiano. Okay? So, si Dr. Icasiano, si Dr. Mariano Icasiano, during that time is the Manila City Health Officer. Okay. And then, Dr. Alfredo Pio de Roda offered a training program to high school graduates with Dr. Prudencia Santa Ana. Okay. So, again, ulitin ko ha, when the U.S. Army left in 1945, in June 1945, the laboratory became non-operational. So, it was reopened by Dr. Alfredo Pio de Roda with the help of Dr. Icasiano or Dr. Mariano Icasiano, which is the Manila City Health Officer. So, it was reopened in October. Okay. And in 1947, in 1947, he offered a training program to high school graduates to work as medical technicians with Dr. Prudencia Santa Ana. Okay. So, Dr. Santa Ana also prepared the syllabus for the training program. Training program pa lang to. Okay? Training program. So, ibig sabihin ng training program nila, during those times, no, noong 1947, 6 months of laboratory training. Magti-training lang sila for 6 months. And after completing the 6 months of laboratory training, they will be given certificate of completion. Okay. So, the training, the 6 months laboratory training, was the start of medical technology education in the Philippines. So, next. The Philippine Union College, the Philippine Union College offered the first 4-year BSMT program. Okay, if mapapansin nyo, balikan natin. Okay, Dr. Alfredo de Roda, with the help of Dr. Prudencia Santa Ana, offered a training program to high school graduates. Again, yung key natin dito is a training program. This training program is offered for 6 months. Okay, is offered for 6 months training, and then after finishing or completing the training, the graduate or the person will be given a certificate of completion. However, in Philippine Union College, so this is a school, okay? So this is a school, the Philippine Union College, the first 4-year BSMT program was offered. Okay? So ito na. Okay? So ito na yung first school that offered the first 4-year BSMT program. So ito na yung BSMT program talaga, which can be finished in 4 years. Okay? So sa Philippine Union College. Okay. So, sino yung first graduate of the Philippine Union College? Okay, sa BSMT program. Yung first graduate, the first graduate of the first 4-year BSMT program offered by the Philippine Union College is Jessie Umali. Siya yung first graduate. Okay? And then later on, si Jessie Umali pursued a career in medicine. So, siya, OB gynecologist. Okay? And then, he also became the owner of a laboratory. Yung laboratory noon is called as Omega Lab. Okay? And then, balikan ulit natin to. Sorry. Okay. Si Philippine Union College, di ba, offered the first 4-year BSMT program. Okay. And right now, the Philippine Union College is now known as the Adventist University of the Philippines. Okay. Si Philippine Union College, ngayon, ang pangalan niya is Adventist University of the Philippines. Okay, this is located in Silang, Cavite. Okay. Okay. So, si University of Santo Tomas or UST. Okay, yung pinaka-highlight personalities dito are Dr. Antonio Gabriel and Dr. Gustavo Reyes. Okay, why? Because they offered MT as an elective subject to BS Pharmacy students. So primarily, ang course ng mga students are BS Pharmacy, but they offered medical technology as an elective. Anong ibig sabihin ng elective subject? Okay? Ibig sabihin ng elective subject, it is not required, it is not mandatory. Okay, so they offered medical technology as an elective subject to 4th and 5th year pharmacy students before graduating. Okay, and then Dr. or Reverend Father Lorenzo Rodriguez naman offered a full 4-year course because of the popularity of medical technology among pharmacy students. Kasi since Dr. Antonio Gabriel and Gustavo Reyes offered medical technology as an elective subject to pharmacy students, okay? So maraming nag-avail nun. Okay? So si Father Rodriguez or Reverend Father Lorenzo Rodriguez, napansin niya yon. So he decided to offer a full 4-year course, offered medical technology as a course because of the popularity of medical technology among pharmacy students. Okay. Yan. Postgraduate studies. Ibig sabihin, class, postgraduate study, yun yung masteral natin. Okay? Masteral courses. Ibig sabihin, like for example, ako, okay, I have already graduated sa Bachelor of Science in Medical Technology. And I want to, further, wants to push through with my masteral or postgraduate studies. Okay, so these are the schools. Okay, so the school that offers postgraduate studies are UST and Philippine Women's University. That is if you want to have the degree of Master of Science in Medical Technology. Okay, in addition, sa University of the Philippines naman offers Master of Science in Public Health or MPH. And then, right now, class, marami na rin yung nag-offer ng postgraduate studies for medical technologies. And one of them is our university, Angeles University Foundation. And marami pang ibang universities sa Philippines. Okay? So, let's proceed with the inventions and innovations in the field of medical technology. Okay, so the first one, tinakil natin kanina to, di ba? Si Anton van Leeuwenhoek in 1660, who is considered as the father of microbiology. And aside from that, yung about sa microscope. He is known for his work on the improvement of the microscope. And after that, because of the invention of the microscope, there is also the discovery of the different microorganisms, yun yung cocci and bacilli, and then also yung protozoans and also spermatozoa, yung kanina na tinakil natin. Okay? Next one is 1796, Edward Jenner, who discovered the vaccination to establish immunity to smallpox. Smallpox during this time is considered as a viral disease that is contagious. Ibig sabihin, nakakahawa siya. And because of this disease, marami yung namatay. Okay? So, it is characterized by the presence of fever and pustules. Parang mga sugat-sugat, ganyan. Okay? So, because of this, he discovered the vaccine. Okay, pag sinabing vaccine, when you are given the vaccine, you gain an immunity against infection. For example, yung COVID-19 vaccine, pag nagpa-vaccine kayo ng COVID-19, you gain an immunity against COVID-19. So just the same with Edward Jenner, he discovered the vaccination to be able to be immune to smallpox. Okay? So smallpox, as I have mentioned a while ago, is one of the most devastating diseases that is known to humanity and has caused millions of deaths during this time. Okay? So ang ginawa niya when he discovered the vaccination against smallpox, kumuha siya ng lesion sample from a similar disease. Okay? okay, from a similar disease which is called a cowpox. Again, he acquired lesion samples from a similar disease which is cowpox. So parang similar lang siya with smallpox, but cowpox is weakened or less pathologic. Hindi siya ganun ka lala. Okay, so cowpox. Okay, this is a weakened version of a smallpox. And then from these lesion samples from cowpox, in-inoculate niya yon sa patients suffering from smallpox. Okay, so that patient, upon inoculation of cowpox, developed the immunity to smallpox and cowpox. Okay, so na-expose siya with the disease using a weakened or a weakened version of smallpox. Okay, so yun yung naging reason why he discovered the vaccination for smallpox. So class, no, yung vaccination na to about vaccines and different immunity concerns, you will tackle that in your third year sa immunology and serology. Okay, so let's proceed with Marie Francois Xavier Bichat. Okay, yan yung buong pangalan niya. Okay, so in 1880, identified organs by their types of tissues. Okay, so this is in the field of histology or the study of tissues. Next one is Agostino Bassi in 1835, which produced disease in worms by injection of an organic material. So Agostino Bassi is sometimes called Delodi. So kilala din siya as Delodi. Ang ibang name ni Agostino Bassi is Delodi. D-E space L-O-D-I. Delodi. Okay. Next is Louis Pasteur in 1857, who successfully produced the immunity to rabies. Okay? And also class, though, aside from discovering the vaccine for rabies, he also discovered or produced the vaccine for cholera and anthrax. Okay? Aside from the discovery of the immunity to rabies, Louis Pasteur also discovered or produced the vaccines for cholera and anthrax. Next one is Gregor Mendel in 1866. He is the father of modern genetics. Okay? Pag genetics, si Gregor Mendel yon. Next one, in 1870, Joseph Lister demonstrated that surgical infections are caused by airborne diseases, okay, or airborne organisms. So he is a British surgeon who found a way to prevent infection in wounds during and after surgery. Okay? So he is the founder of antiseptic medicine. So kung napapansin nyo, Lister, ano yung word na naiisip nyo kapag Lister ang sinabi? Diba? Listerine? Okay? So Listerine, yung mouthwash, that is an antiseptic. Okay? So kinuha dun yung pangalan nung mouthwash na yon. Okay? So because he is the founder of antiseptic medicine. Next one is Robert Koch or Robert Koch. Okay, kung paano nyo siya bigkasin, bahala na kayo. In 1877, okay, so he presented the first pictures of bacilli, the anthrax bacilli, and later on the tubercle bacilli. Okay, so class, tandaan no that si tubercle bacilli is the causative agent of tuberculosis. Okay, tuberculosis is brought about by an organism or a bacteria. So anong tawag dun sa bacteria that is the causative agent of tuberculosis? That is the Mycobacterium tuberculosis. Okay? It is also a tubercle bacilli. Yun yung si Mycobacterium tuberculosis. Next one, 1886, Elie Metchnikoff, okay, and Ernst von Bergman. Okay, si Metchnikoff described phagocytes in blood and their role in fighting infection. So, as an overview lang, since we will be tackling this in hematology, phagocytes are uh, phagocytes are used to ingest foreign materials. Okay, these are part of the whole bloods. These are used for cellular ingestion. Okay, like for example, merong foreign body such as the virus. Okay, such as the virus na pumapasok sa katawan. So, mag-activate si phagocytosis wherein i-ingest niya yung foreign materials in order for you to uh, uh, not to get the infection. Okay? And then next one is Ernst von Bergmann, the stem sterilization in surgery. Okay? So parang the killing of microorganisms by the use of stem sterilization. And then in 1902, Karl Landsteiner, kapag ABO blood group system. Okay, the classification of human blood based on the inherited properties of red blood cells. Okay, this is important, yung ABA blood group system sa blood donation process or during blood transfusion. Next one, in 1906, August von Wassermann. Okay, si von Wassermann developed the immunologic test for syphilis. Syphilis is a sexually transmitted disease, no? This is a sexually transmitted disease wherein merong test to test for the antibody for syphilis. So what do you call this test? Which was taken from the invention of August von Wassermann. So what do you call this test? To test for the antibody for syphilis. Okay, this is the Wassermann test or the Wassermann reaction. Okay, Wassermann test or Wassermann reaction is an antibody test for syphilis. This is also the first blood test for syphilis. And then si Howard Ricketts naman discovered the virus and also the bacteria which is called the Rickettsia. In 1929, si Hans Fischer worked out the structure of hemoglobin. So, because of this, he won the 1930 Nobel Prize for Chemistry. And then, in 1954, si Jonas Salk developed the vaccine for polio or poliomyelitis. 1973, si James Westgard naman, James Westgard introduced the Westgard rules. These Westgard rules are still done until now, no? So these rules are done in the laboratory quality control, especially in clinical chemistry. So ito, i-take up nyo siya during your clinical chemistry subject. In 1980, introduced the hepatitis B vaccine by Baruch Samuel Bloomberg. Okay? Baruch Samuel Bloomberg introduced the vaccine naman for hepatitis B. 1985, si Kary Mullis develop yung PCR. Ito, naging very famous siya, yung polymerase chain reaction or PCR during the pandemic days, di ba? And 1992, si Andre van Steenteghem introduced the intracytoplasmic sperm injection or the IVF. Now, IVF is known as in vitro fertilization. Dito yung mga hindi magkaanak. And then, i-grow yung sperm cells and the egg cells coming from the parents sa labas. Okay, and then, pag nag-develop siya, ipapasok siya dun sa uterus ni mother para mag-grow na siya. And the mother will be pregnant. Okay, once naging successful siya. Next, in 1998, James Thomson derived the first human stem cell line. Okay, so I guess class, this is the end of our discussion. It's quite long, pero it's kind of interesting, hopefully, because you have learned about the different history or how medical technology started. Okay, so these are the references that we have consulted for the completion of this PowerPoint presentation. Okay. Okay, so thank you so much, and I hope you have learned something from this. And please prepare for a short quiz on our next meeting. Thank you.